Hello, everybody. Welcome back to Igniting Hope Radio. My name is Samantha Hidalgo. I'm the Public Health Program Manager here at the Buffalo Center for Health Equity, and I'm joined by a very special guest today. We've had the pleasure of having a High Road scholar join us for the last 2 months over the summer, working on a really interesting maternal health project. But before I tell you any more, I'd really like it if you could introduce yourself. Tell us who you are.
Yes, of course. Hi, everyone. My name is Alia Amer. I'm a rising senior at Cornell University, and I am a High Road Fellow, which is kind of an interesting program at Cornell. Basically, it's part of the Cornell Industrial Labor Relations School, and they send a cohort about 20 to 25 students to immerse themselves in Buffalo. And they take part of different sort of community engagement opportunities. So it could be a co-op, it could be a union, and so I applied to be placed at the Buffalo Center for Health Equity because I'm majoring in health policy. It's something I've been studying. And yeah, I just wanted to learn a little bit more about what it meant to be engaged in public health and in the Buffalo community specifically because um, it's talked a lot about other people I knew in the High Road Fellow program.
Yeah, so thank you so much for that introduction. This was our first time having a High Road fellow, and I think when I was putting in our application, I knew we really wanted to focus on maternal health. If you want to talk a little bit more about kind of what drew you to us, and then what you've been working on within maternal health.
Yeah, when I first applied, I did a little bit of research about all the placements in Buffalo, and I think what drew me was just the mission statement that was on the website, the mission to just reduce health disparities within Buffalo. I did a ton of research about the health disparities that were there. I didn't know too much about maternal health going in, but I think that's what was really exciting about it. I think in our little intro meeting, you mentioned maternal health, and I was like, perfect. I'm gonna learn a lot this summer. And I just I think like throughout the 2 months, I only like dipped my toe in, but there was just so much out there, which was a little bit overwhelming, but I did end up learning so much while I was like wrapping things up. So I guess I could talk a little bit about the
Yeah,
project
what
I've
you've
been
been
working
working on
on.
with us this summer.
Yeah. Uh, you gave me like some guiding points, but it was nice that you gave me the freedom to like explore whatever I kind of wanted to do. But you mentioned the Finland baby box policy. So I first just kind of looked into the maternal health statistics that were just throughout the United States, in New York State, and then in Erie County in particular. And then I kind of zoom into Buffalo. And I think that was just a lot to get through during the first couple weeks because there was a lot out there. And then I researched a specific policy that originated in Finland called the baby box policy, which is a maternal health policy intervention that is universal in some countries abroad that would provide all mothers an opportunity to receive a box full of essential items for childcare. And that took up a lot of my summer because it was the first time I've sort of immersed myself into that sort of policy research. And I just was surprised with what I found. And I was able to have a lot of interesting conversations with you and with some actual policymakers on a federal level about what would it mean to introduce this sort of policy in the United States and then in Erie County, if that would be possible. So it was really exciting overall.
I think there's so much to be learned from international models that, like, although we can't maybe replicate here because of a lot of reasons, it's still really important to learn kind of what's been done before to see how we can adapt it here locally. um, in that vein of local, if you could talk a little bit more about what disparities are like in New York State, and if you can get as more specific as Erie County, I think that's really helpful. I know one of my chief complaints with maternal health data is just like how slow it is coming out of the state. I know you've cited the March of Dimes annual report card, which is a really wonderful report. Unfortunately, New York and more specifically Buffalo don't score super highly on it, but I think it's a really great snapshot of like things that are kind of happening around the country. But if you could please share some stuff that's maybe a little bit more local to Buffalo, Erie County, New York, in terms of maternal health disparities.
Yeah, definitely. I think just in general on an international level, maternal health is used as sort of measurement or reflection of how developed
Hmm.
a nation's healthcare system is, which is why it's so surprising to me when the United States kind of boasts a sort of developed, specialized healthcare system, and then you
Hmm.
kind of look at the maternal health statistics, and you look through the March of Dimes report, and it just doesn't seem
Well, yeah, given
that
we
good to
spend
me.
trillions of dollars on healthcare and prescriptions, and we're still trailing so far behind other countries that have smaller GDPs than us. Again, maybe even smaller populations, but are still, powerhouses in the world economy.
Yeah, yeah, it doesn't really match up, and so doing that sort of research, I kind of wanted to pay attention to the little discrepancies because there's a lot of disparities when it came to maternal health. Like when you look through the March of Dimes report, New York State isn't really an outlier. It kind of matches up with the general national statistics in maternal health. So, um, when you look at infant mortality, for example, which is the amount of infant deaths before year one per 1,000 live births, the average in New York State is around 4.3. But then when you look at racial health disparities for Black mothers, the infant mortality would be about 10.1. So
Wow.
that's a very,
Double.
very, yeah, it's a very large gap. And so that kind of is a big indicator that something isn't really right. And when you look into Erie County, it's um, a county that has a lot of residential segregation within the city of Buffalo. I think 37% of the city of Buffalo is Black. And so if you apply those infant mortality statistics and kind of look at the city of Buffalo, you could tell that the maternal health isn't doing that great. So I kind of did a little bit of my research by looking at New York State as a whole in the March of Dimes report, and then zooming in on the residential segregation that's happening in Erie County and specifically in the city of Buffalo, and knowing that there has to be a larger maternal health intervention in there.
Hmm.
Because I think March of Dimes also cited Erie County as having worsening levels of maternal health, and it would probably be a hot spot in Buffalo to make some sort of change and intervention there.
So, in that vein of change and intervention, part of my own passion project within this work is trying to see if something like the Scandinavian or UK model of baby boxes or baby kits could be an efficacious model to bring here to not just the United States, but more specifically to Buffalo and Erie County. Can you talk a little bit more about what Finland's done and what's going on in the US or has the potential to go on in the US related to baby boxes or baby kits? And what is a baby box slash baby kit?
So a baby box is Finland's idea. I think any other policy that's sort of come up recently, they always cite that it's been inspired by Finland's successful policy. Finland has a history of having not the best maternal mortality rates and not the best infant mortality rates, and they have had a history of just making some sort of policy intervention in the past to mitigate that. And this had to be about a century ago when Finland thought of the baby box pilot, which is a box full of essential items that would just help a mother care for her child during a very, very vulnerable time. So it's the list is so long. Clothing, mittens, hats, they change on a yearly basis depending on parental feedback. But it would just have a bunch of essential items. Some have food, there's we'll have diapers that will change, a lot of wipes. Another important thing is that it'll have educational pamphlets
Mm.
on like just this important information like safe sleeping,
Hmm.
and that has been just like really valued. The box can also act as a crib. So in Finland, because this policy has been just going on for about a century now, and because the uptake is around 95%, it's
Wow.
actually, yeah, it's normal for babies to sleep in a cardboard box in
Hmm.
Finland. It's like a culturally normal thing to do. For for nations that have implemented the baby box policy maybe later, it's a little unusual
Hmm.
because babies
I'm
might
sorry.
be, no, you're good. Um, but yeah, it's in other nations that have implemented the box in say 2017, like Scotland, they see a baby sleeping in a box a little weird because it's such a recent policy. It hasn't really been culturally integrated yet because it's only been so recent. But yeah, the baby box policy is universal in Finland, and it's been piloted in Scotland in 2017 to be universal as well, which is just incredible because it's just a guarantee that you would get around 400 euros of just essential items that you
Mm-hmm.
don't really have to think about. So it takes off the personal burden of a mother during a very vulnerable period of time that they don't even have to think about buying certain things. If they forgot to buy a thermometer, some boxes have had a
Oh,
thermometer
wow.
and they could think to use it. And so I think it's just a really good way to relieve postpartum mental health and postpartum burdens that is a great contributor to maternal mortality. And it's something we should probably consider in the United States as a very big policy intervention because of how our maternal health statistics have kind of trailed behind other
Mm-hmm.
developed nations.
And that kind of brings me to my next question of we had conversations about like could this be happening at like a national, state, or local level? And part of your research was examining what's already kind of been done in the United States and pilot projects that are hopefully going to be expanded nationwide. Now, I think it's important to note that both in Finland and in Scotland, they have socialized healthcare. So, like, everyone's under a national health system. And unless Medicaid for all like drops from the sky, like, that's going to be a little bit harder to do here in the United States. Like, we do have limitations in what is feasible in terms of like getting things to people through like a unified healthcare system, but that hasn't stopped people from trying to do something already. So if you could talk a little bit more about what's being done right now in the US.
Yeah, definitely. I When I came into it, I thought of how different the healthcare systems were, and in my head there was like, there's no shot something like this could be
Mm-hmm.
introduced into the United States. But I was
Mm-hmm.
surprised because I mean, it is a very inspiring policy. And if you look at Finland's maternal health statistics, they're very competitive as being some of the best in the world.
Mm-hmm.
So it made sense that it would want to be employed in the United States, at least in some level. At first, I saw that New Jersey had implemented a statewide policy some years back to just give a box. Nothing
Mm-hmm.
inside of it, but to promote safe sleeping with a box, and that was inspired by Finland's policy, but I don't believe it lasted very long.
Mm-hmm.
There's also a new policy that does not allow for boxes to be sold for sleeping purposes because
Mm-hmm.
I think it was deemed to be unsafe. So now any intervention that would be inspired by that policy, it wouldn't be in a box, it would be in a kit, basically with the purpose of just giving mothers essential items during
Mm-hmm.
that period of time of post birth. I think the biggest pilot that's happened so far is a partnership that was launched in 2023 between former Vice President Kamala Harris and a big nonprofit called Baby to Baby, which is a pretty big pilot where they would give mothers something called a newborn baby kit. They had a lot of essential items put into this kit, and I think they had launched this in some areas in about 3 states, and they had done an evaluative study to see what the effects were.
Mm-hmm.
And I think it was just very successful. And so they expanded to 7 states, but it's a very, very slow pilot because we're a very, very big country. So I think they had to use a pretty big filter system to pick like what distribution facilities can
Mm-hmm.
be used for this process. Who
Mm-hmm.
needs this the most?
And even just like the number of boxes, I think one thing I thought you were really successful in your research was like trying to get answers straight from the source, right? So like we did have a meeting with the Department of Health and Human Services, a couple folks out of the office that's been working with Baby to Baby on this pilot, and finding out that like they can only give out up to like 1,000 kits like per state or per distribution center. So again, we have what like 330 million people living in the United States, roughly half being of like childbearing abilities, and like maybe another couple. So it's like a pretty significant amount of people that could be receiving boxes compared to 1,000. But to your point about just like how large the United States is and how large maternal health disparities are, like at least it's something. Like we're getting our foot in the door, and I know that they put out a report. If you want to talk a little bit more about what some of their findings were and, how we could expand the project moving forward.
Yeah, totally. I think it was just really interesting that they were able to publish a lot of their findings because for us to maybe introduce something like this in Erie County, some level of feasibility
Mm-hmm.
would have made things a lot more smoother.
Absolutely.
One of their findings that was really not so surprising to me, but it was really helpful was just how much it relieved postpartum stress and anxiety. When
Mm-hmm.
there are so many options to choose from, a list so long of things to buy for your child,
Mm-hmm.
something must slip through the cracks, and it's a
Mm-hmm.
very anxiety inducing process, and you're also so physically stressed. So to be given something that has all the basic essentials and to have pamphlets with everything you need to know, or at
Mm-hmm.
least everything important you need to know, it takes a big burden off of you, especially when you're in a very socially vulnerable position. The way they kind of picked the distribution facilities was based on the CDC's social vulnerability index, among other sort of measurements that they used to
Mm-hmm.
just pick like who will benefit from this the most,
Mm-hmm.
which I think was a pretty good selection process because again, like the U.S. is just so
So
big.
big.
I remember kind of looking through the vulnerability index and finding that Erie County and Buffalo in general just slipped through the cracks because
Mm-hmm.
Erie County as a whole does not represent Buffalo and the health disparities that they have. And I just thought like, wow, Buffalo really would benefit from a policy from this.
And I think it's hard too when you have New York City that's 8.5 million
Mm-hmm.
people. I know in some of the statewide data that was released back in January for the maternal health grand rounds that the State Department of Health did is like we actually have worse maternal health outcomes than New York City
Yeah.
when accounted for population, right?
Yeah.
So when you're looking at I'm trying to remember the metric if it was maternal death or maternal hemorrhage, it's like again, we're just experiencing it much more than I think people outside of the state realize, or maybe outside of like just the New York City area. Because again, it is so many people down there. So I think a lot of like resources and money and political power tends to get settled there, which again, if we're talking about a representative government, they have more people than we do. But that doesn't necessarily mean that like because we're a smaller community that like we have less disparity.
Yeah. I think I tried to employ that perspective from like somebody who isn't doing research in the
Mm-hmm.
Buffalo community. And
Mm-hmm.
I kind of looked at the index and I looked at their measurements and I was like, wow, like nobody would zoom into Western New York and like the
Yeah.
city of Buffalo and be like, this is where we need to be. You would obviously just go to New York City as the first place. So I kind of just thought of how Western New York could be overlooked when it came to just any New York State policy intervention
Mm-hmm.
and thought it would be important to just note that. In their evaluative report, they also just mentioned the appreciation of the feedback from the people who received it. It was just
Mm-hmm.
never a bad thing. I compared that evaluation from Scotland's evaluative report, where because their healthcare system functions so differently, a lot of parents felt like they didn't really need it.
Mm.
Some of them were like, I feel like somebody who needs this more should have this. This feels like just extra clutter in my room.
Mm.
That was not feedback that was found in this evaluative
Mm-hmm.
report, which I think was interesting to note. And then another piece of feedback that we had gotten from the meeting was just how fulfilled some healthcare workers were in giving these baby
Mm-hmm.
boxes to parents because they had appreciated it so much. So I think overall, reading their report just highlighted just how necessary this was.
Mm-hmm.
You didn't even need a long term study to know that this sort of maternal health intervention to relieve postpartum mental health is just a necessary thing. And so that just made me more sure that it should be implemented in at a more local level.
Yeah, and I think too, so much of what we hear when we work with clinicians and healthcare providers is like they're limited in the scope in which they can provide resources or follow up with patients on things that aren't related to their physical health, right? And that we have so many gaps within our healthcare system that like if you express to your OBGYN or your primary care doctor that like you're having a mental health crisis, but the places that they refer you to take care of those mental health crises or issues are backed up, right? Like there's a months long wait list and like you've kind of been dropped from the system. And so in a place like Scotland or Finland that maybe is able to close those gaps a little bit more, you see the response of like, well, I don't really need this. Like, give it to somebody else who may need it more than I do because my needs are being met in a system
Yeah.
that's, designed to serve the people of that country. So I can 100% see like the distributor or the provider, whoever's giving out these baby kits, seeing and feeling that gratitude of like, okay, like we were able to address a need immediately versus having to like, okay, well, have you called this person? Have you tried this? Like this agency may be able to help you, but like you have to fit this specific criteria. And although there was eligibility criteria to receive a kit, you're able to again address that person's need immediately versus, having to like shuffle them around the social network of help.
Yeah, and that is like the general idea people get from the United States Social Care Network, that it's just jumping through a lot of hoops,
Yeah.
getting referrals upon referrals upon referrals that you don't even want to try anymore, and you just kind of look inward.
Mm-hmm.
And it was just very different from what I've seen looking at the other policies, because that was the main feedback from Scotland's policy. I think it was just register with a midwife and everybody gets a box. And
Mm-hmm.
some of the feedback was like, well, see, I don't really need this. Like, give it to
Mm-hmm.
somebody else who wants it. But it was just generally very helpful. But in Finland, you have the option to exchange the box for like a lump sum of money.
Oh, wow.
Yeah, and I think about a third of people actually choose that instead. And it shows that they're still being supported. But if they feel like they don't need it, they'll opt for that. But two-thirds of people still kind of opt for it because they don't have to deal with the burden of getting all these
Mm-hmm.
things during the post-birth period.
For Scotland, Finland, and maybe even for the emerging US model,
Mhm.
is there any sort of distinction between the box that you receive for a first pregnancy or a second pregnancy, or is there equal opportunity to get a box for maybe each pregnancy a family has?
I believe at the Scotland model, it is just for any pregnancy. And I think they're trying to change that because a big piece of feedback that they received was it's repetitive. Like I
Mm-hmm.
could just
Mm-hmm.
kind of repeat and use what I've been given, and
Mm-hmm.
other people might need this more as first time parents.
Mm-hmm.
So I remember a big piece of feedback was that first time parents are going to need this a lot more. I already have some of the stuff, or
Mm-hmm.
I already know the essentials that I need.
Mm-hmm.
When you're a first time parent, you don't really know what you need yet. You're getting
Yeah.
this for the first time. But I do believe, because this new pilot that's being introduced into the US is so new, they've given out like not that many
Mm-hmm.
boxes. They It's not really set in stone just how you're going to get the box. So I feel like if you're in this area and you're giving birth at the specific distribution facility that was chosen and you're having your second child, you would be eligible to receive the baby box
Mm-hmm.
because it just hasn't been around long enough to know
To
just
make
who's
that
getting
distinction. That I think is important within the Scotland model too, of like, if I'm being so well cared for to get this resource, does it then become repetitive? And how do I maybe then shape it a little differently so that like I'm still meeting your potential needs as like a second, third, fourth, fifth time parent?
it.
Um, but that's really interesting. So I want to transition a little bit to talk about the impact that the baby box can have on mental health. One of an emerging statistic that's come out of a lot of maternal health research is showing that like maternal death up to a year or longer after postpartum is a direct result of mental health, right? Or substance use disorder, which
Mm-hmm.
is a part of mental health. And so, how can something like this impact that postpartum period where, mental health is something that we are showing emerging concern for?
Yeah, I think what's great about a newborn baby box or a newborn baby kit is just how much power you have when you are giving it to somebody in a very vulnerable period.
Mm-hmm.
When you are giving birth, you are in such a financially vulnerable period of life
Mm-hmm.
where you feel like you might not be able to afford everything essential to care for your child, and
Mm-hmm.
you feel like you don't have all the space for all the information you have to care for your child. So you feel like something important might have slipped through the cracks. And so when giving out a kit, they will take it and they will read whatever pamphlet is inside.
Mm-hmm.
And so when it comes to information on safe sleeping, which is, if you don't follow safe sleeping just guidelines, it could lead to SIDS, which
Mm-hmm.
contributes to infant mortality. And when you put that into a kit and you read it, like, it's kind of a very direct form of public health education
Mm-hmm.
that you're giving, and it does reduce the sort of burden of and the stress of just not knowing if you know everything.
Mhm.
And also, it reduces the burden of having to go through sort of resource navigation when you're physically stressed when you have just given birth. Another thing is the way, so we just talked about with social care networks and how they operate in the United States. If you need something, if you need a resource or support, it's not the easiest
Yeah.
like way to get it, because you might just get referred and you might be on a wait list, and then they'll refer you somewhere
Mhm.
else, and then they took your insurance but now they don't take it anymore, and you're like, I
Yeah.
swear they just told me to go here. And so if they're it just gives you everything sort of in one place, and you don't really have to deal with that sort of stress as much.
Mhm.
um, and if maternal health is and like postpartum mental health is being sort of discussed because it is like a big contributor of maternal mortality, I think there's a lot of research being made. There's a lot of action points to be done.
Mhm.
That could also be integrated into the baby kit.
Mhm.
Um, they could teach mothers how to self care. It doesn't all have to be for the baby either. Like teach mothers how to care for herself, take time for herself. That could be integrated into the baby kit too. There's a lot of creative control when it
Mhm.
comes to public health education, and kind of getting spreading awareness and getting it out there that could be put in here, and it's very tangible because they don't have to make 100 million phone calls to get what they need.
Yeah.
They could just get it handed to them and they'll read it, so it's a lot more straightforward. And it could, I'm going to bring up another evaluative feedback from the United States pilot, which is that it improved governmental trust,
Yeah.
which is one of the main reasons that it got launched in the first place. And I think that is just a big reflection about how people perceive social care systems in the US and just the US healthcare system in general.
And I think it's important to note that the Department of Health and Human Services, nor any government entity at the federal level, is putting money to this, that it's baby to baby that's funding and distributing, and that Health and Human Services is doing the evaluative measures and the report outs and the research. And so, in a perfect world, the federal government would be able to, put this out, make it its own, have that kind of like trust in a system. I think given all of the changes that have been happening in the federal government this year, that like there is maybe wavering support
Mm-hmm.
for some of the initiatives, other initiatives that the federal government is trying to do. But I think even if we could pilot something like this in Erie County, like that then instills trust and faith into like a system that our tax dollars are supporting,
Yeah.
right? Like I would much rather my tax dollars go to supporting new families, young babies, infants, and mothers than maybe some of the other things that it's going towards right now. And so I think that's a really important piece. Um, we only have a few minutes left, so I want to make sure that we're hitting on kind of all of the things that you've put in your brief and the research that you've done. Is there anything else that you think is of importance to share when it comes to baby kits, boxes, maternal health disparities?
Um, I think I've talked it up
Yeah.
quite a lot. But yeah, I think just throughout my research process, one of the biggest takeaways that I've gotten personally is that, yeah, it should be done on a local level, because I thought of the different ways it could be implemented. And yeah, we could, fingers crossed, hope that something very widespread would reach us.
Hmm.
And then that's like a little less work, and
Yeah.
that would be like a dream come true in a perfect world, like you said. But implementing it at a local level would just make such a big impact. Just knowing how concentrated um, the health disparities are in Erie
Hmm.
County, it would just like really pack a punch as a very direct and impactful policy, especially in the sense of public health education and maybe incentivizing prenatal care.
Hmm.
Um, that was just one thing I realized, like, wow, like we really are handing this to somebody. And based on the pilot that was done in the United States before, it is really received with open arms. So this is something that's needed based on that feedback. And I think it's just something that could be explored and could be more feasible
Hmm.
based on the fact that it has been introduced in the United States. We're not doing this with our eyes closed. We have
Hmm.
some research to even fall back on, and we can maybe use some focus groups to model after to evaluate the process. So it's just definitely something that can be looked into on a local level for sure.
And I really like that point you made about like creative control, right? Like
Mm-hmm.
there's no, although there are like maybe options and models that are from other countries and even within other states in the US that have done these baby kits, like we could really make it something that's
Yeah,
encompassing of like our local need, right? So we have really harsh winters, right? Including baby snowsuits or baby blankets. And um even to your point about like the self-care items for moms and families and birthing folks to have postpartum, right? Like that is such a integral part of parents' experiences of like having children that I think we could be doing a lot more in those spaces. So thank you so much for this conversation today and for all the wonderful work you did over the summer. If you'd like to share a little bit more about what you're going to be doing after your time with us and maybe what you would like to be doing after you graduate.
yeah. I think just this summer I've been thinking about that a lot. I think we've even spoken about this before. Being a rising senior and with like just the turbulation that's sort of happening in the public sector, I think I would have had a better answer for you in December. But I've just had a lot of fun researching a policy that was so specific and so niche and learning everything inside and out about it. I've just been inspired to do a little bit more policy research like that. And I think I'd like to do that during my last year and just find out what I come up out of it. I went into this knowing very little about more maternal health and then coming out knowing everything about a specific policy
Hmm.
regarding it. And so I'd like to just do a little bit more of that and kind of spread my wings in the public health field and just see what I like and go figure out what I'd like post grad. Definitely looking into getting a master's, but I just want to try new things and look into new subjects that I know very little about
Hmm.
because I don't know, I just really liked what I found. And like just knowing so much about a very niche topic was something that I really like. So going into research is something that I would love to go into during my last year at Cornell. I wouldn't miss it.
I think when I talk to interns and when I talk to young people who are, maybe not fully matriculated through their programs and they're like, I don't know what to do next. I'm like, this is the sandbox. Like internships like this, experiences like this are really great ways to like see if this is what you like or what you don't. And I think it's just as valuable to find out that you don't like something as it is to find out that you do like something because the stakes are low, right? Like
True.
if you came out of this completely hating your experience, which I'm so happy you didn't, then you would know just as much as you do now, having really enjoyed and embraced this experience. So thank you so much. I think this has been wonderful, and thank you for joining us on the podcast. Um, yeah,
Yeah, thank you so much for having me. This was a lot of fun.
hopefully we get baby boxes here in Erie County.
Fingers crossed.
Thank you everyone for joining us on this episode of Igniting Hope Radio. We hope that you like, subscribe, keep up with all of our episodes, and we hope to see you. I'm going to do a shameless plug for our Igniting Hope conference. We're going to be planning a community health equity plan for the region. Maternal health is definitely a part of that, and so we hope to see you there for Igniting Hope weekend, September 19th, and the conference September 20th at the Jacobs School of Medicine. Thank you. Look, I even plugged Igniting Hope.